Yeah, look, I'm going to talk a little bit about this project that we've been doing on voices in dementia. Those are my co-workers, and these are some of the partners that we're working with. I think the interesting thing about this project is that it involves not only the government of Australia, but various provider groups, people who provide services, as well as Dementia Australia, which is a sort of advocacy group. And it's a 3-year research project funded by the NHMRC, National Health and Medical Research Council. And they've developed a cognitive decline partnership centre, which is interesting insofar as it has about 30 projects now, which are looking at how people can live with dementia in the community and clinical innovation. So it's very practical. We also have an advisory group to each of the projects. So we've been working with the National Consumer Network of people with dementia and their carers as part of the project. So occasionally we take issues to them, we ask them about questions, whether there's anything missing. And we ended up interviewing about 111 people, including carers, people living with dementia, and various professionals. Now, the novel element of this is that we've got quite a large number of people living with dementia, which will rarely interview themselves. And also, we extended the normal range of professionals to include service professionals, by which we mean hospitality staff, hairdressers, people who meet people in the street and people with dementia on a day-to-day basis. Now, why would this be interesting at this point in time? Well, we're seeing a move in the understanding of dementia from cure to care. Cure has proved to be much more expensive and much more complicated than at first thought. And at the same time, there's greater emphasis on public health campaigning and public health lifestyle changes which can reduce the likelihood of getting dementia in later life. There's also been a shift towards people with dementia living in communities. So you're probably familiar with these initiatives of dementia-friendly villages, but now we're moving into a whole new phase of dementia-friendly neighbourhoods, dementia-friendly municipalities. And as part of that, we're seeing an increase in the voice of people living with dementia themselves as a sort of civil rights issue, reflecting similar changes with the disability movement. Because although many people think that if you're giving a diagnosis of dementia, the next day you're almost a vegetable, in actual fact it's a chronic disease that takes years to have its full effect. So people can live for many years with certain forms of cognitive disability, but still be quite articulate and able to engage with community. And that in itself is changing providers' assumptions about what, who can speak for who. So it's challenging a lot of deeply held views by providers that they are in some way speaking for the people that they provide services for, rather than listening to their voice. So we became interested in what are those voices? How much do they overlap? How much do they agree? How much do they disagree with each other? And that's really what this is about. Now, today I'm going to be talking to you about a number of different perspectives. I'm focusing on voice, which are those groups that I just mentioned, but also closeness. When we did our preliminary qualitative interviews, we found that the degree to which you're close to dementia affected your perceptions of it. So we wanted to take a particular look at that and say, well, if you've got a family member, if you haven't got a family member, if you're a carer, if you actually have it yourself in the first person perspective, how does that influence how you perceive priorities around the disease and around what you want in terms of care and integration? Well, I'm not going to talk about age today because it's quite complicated how age interacts with this, but we did find a relationship with the degree to which you can put yourself in the shoes of another and your age group, but it's a sort of U-shaped graph. I can talk about that another day. And finally, we looked at the perspectives of local campaigns, so campaigns with people with dementia in local communities and national campaigns to see whether they varied in terms of the public health messaging that they were doing. And these are the questions we asked. So when I say dementia, what do you think about? How far do you think dementia is perceived by? How do you think it's perceived by people in the street? Is it a normal part of aging? If you were diagnosed with dementia or are living with dementia now, what would you want? And what would an effective campaign look like? And this is just to show you some of the characteristics of the group that we interviewed. And here, this focuses on this relationship of how close are you to the person with dementia. So in this first part of the talk, I'm going to be concentrating on that, and we've summed professional groups, so all the professional groups together, but we divided them by whether they said they had any family connection or not. The other thing to notice is that there are many more men in our respondent pool who had dementia, but many more women in the caring professionals working with this, who were willing to respond at least, because we left we worked through various community groups. We left little notices in hairdressers and shops and things like that to try and recruit as many people as possible. If we went to stay in a hotel, we tried to interview hotel staff with creative in how to get hold of these people who would not usually respond to this sort of survey. So this is the first thoughts on dementia. And the thing to notice here, I think, is that we asked whether people had predominantly negative thoughts, positive thoughts, or age-related thoughts. So we got their responses, and then we categorised them by whether they were negative, positive, or neutral. And what we found was that carers predominantly had negative views on the impacts of dementia. These are often about relationships, their relationship with the person with dementia, their dreams of the future, their finances, and also social isolation and shunning by other people who didn't want to. Their old friendship groups and networks tended to drop away because they didn't seem to want to interact with them anymore. But we also picked up... Yeah.
Can I how did you categorize them ambivalent?
We haven't got an ambivalent category.
Okay, so it was either mostly positive or mostly negative.
Mostly negative, yeah. The second thing that was interesting was that people with dementia didn't necessarily see it as an entirely negative experience, but they mentioned things like new friendship groups around meeting dementia support activities. They found that having been diagnosed, this had a sort of calming effect because they knew what the problem was, but before they were just, what's going on for me? And finally, there was a sense of accepting wider life course issues and putting them in perspective, which were being picked up there. We didn't expect to find that, and there's more that can be said about what might be lying around that mismatch between carers and people with dementia. Carers were also the most likely to say that this was an age-related phenomenon, and also concerned more about their own future and their own welfare and their own likelihood of having dementia than other groups. But as you can see, as we would probably expect, the professional groups, both with or without a family connection, had more neutral thoughts. They talked more in terms of the descriptions of the disease, preventive things that can be done, the causes of the disease, who might be involved, but not this emotional effect that we saw with the other two groups. Normal part of ageing, well, we only ask this question because this is what public health campaigners have been pushing for a long time. It's not a normal part of ageing, it's a disease. And what we found was that, well, yeah, but this is not an issue for the groups we interviewed. They're all taken in view that it's not a normal part of ageing. There's only a small group who would think otherwise. But nevertheless, that's an important question around campaigning. Should we be continuing to campaign around that message? And of course, there are a whole lot of vested interests to push that particular element of the experience of dementia. Now, when we asked people what would they want, we found, again, a difference between people with dementia and some other groups. People with dementia really wanted to be socially engaged. They wanted to be part of communities. They wanted what we could think of as a social inclusion agenda. They didn't see why they should be left out of civic activities, social activities, and so on. Carers were much more concerned with the support that they got and also interpersonal connections. So they were more concerned with not only their own relationship with the person with dementia, but also how they could maintain a current and future role in society. So there are issues about employment. For people who take a long period of caring, they try and get back into the workforce. And good professional care was largely the priority of, as you may expect, professionals, carers, but not, interestingly, people with dementia. I didn't seem to see that as an issue.
You didn't grant the wishes. I mean, because several people had several wishes, but you didn't ask them what was most important.
No, we didn't. No, we just we started with a really a qualitative approach, and then we got the for each of the questions we separately identified themes, and then we categorised the number of times a theme was mentioned along those different dimensions. So no, we didn't go further than that at this stage. Now, when we look at what would an effective campaign look like, we also see that people with dementia want dignity and this normalising approach. And whilst that is emphasised with other groups, particularly professionals with a family connection, you can also see that other groups were looking for understanding and interaction as a priority issue. And I'll come into how those two might connect to each other later on. So, in summary to this stuff, which is effectively around this notion of closeness and voice, people with dementia are the most concerned with normalising their situation and emphasising dignity and rights, as you might expect. These were also emphasised by other groups to a lesser degree, at least by those with no family connection. Understanding and interaction between people with dementia and others emerged as an important priority across professional and carer groups, with people with no family connection giving the highest emphasis. People with dementia place the least emphasis on this issue. And carers identified the need for others to interact positively with themselves and with people with dementia. Professional perspectives without prior connection emphasise the lack of knowledge and inhibition in how to approach people with dementia. And they also acted on a need-to-know basis. Effectively, they said, look, there's all sorts of campaigns out there around family violence, around drugs, around youth unemployment. Why should we give this a priority? We'll find out about it when we get to know about it. Whereas other groups who had a family connection, they believed that the principal way of getting people involved in campaigning was if they had a personal connection. Otherwise, they thought, rightly as it turns out, people would not be interested. And that was quite a shock to our people with dementia activists and carers when they saw this, and when we took them to conferences and they met all the other groups and nobody showed up to our workshop, and they thought, oh, this is going to be a bit harder than we thought. So when you step from outside of your in-group to see the wider picture, then you're in a much more competitive public health environment. This is just the voice and age, just cut by voice and age. But here, I've just put this here so you can see the spread amongst the different professional groups. So healthcare workers, social workers, and service professionals there. It's roughly the same, but we're getting more men showing up in social work and services. Or at least people who would respond. So this is what we look at when we look at voice on its own, rather than pooling it as how connected are you to the issue. And three things I think are interesting about this, principally. One is that the people with dementia, and to a degree, service professionals and social workers, have this idea around social inclusion, that older people with dementia should be part of a normal part of society. When we look at that second circle up there, all the professional groups and the carers, but not people with dementia, saw this as a problem of communication. Basically, they didn't know how to communicate with people with dementia. They were either inhibited or felt that they didn't have the social skills to engage with that group. And the final circle up the top simply shows that there's a close connection between healthcare workers' perceptions and carers' perceptions, particularly around prioritising awareness raising. But what they meant by awareness raising was a bit different. Carers largely meant awareness of the issues and problems around living with dementia, and healthcare workers tended to focus on preventive methods. This one I've thrown in because we looked at the relationship between local and national campaigning. There's been quite a few initiatives in Australia and elsewhere that are taking the governance of campaigns by people with dementia and engagement in small communities as their priority. So we were interested in, well, what's the public health approach that they're using, what's their priority, when you compare that to national campaigns. So and we interviewed national campaigns in mostly in Western English-speaking countries, so Ireland, UK, Canada, USA, Australia, New Zealand, and we also interviewed campaigning organisations in Finland and in Sweden. We didn't get a reply from the Danes, but and then we ran out of time, so sorry about that. Now what I'm showing you this is because the blue one is the national campaigns. So when you pool the responses of national campaigns, you find that they're fairly closely connected in what they will be campaigning about. The red dotty one is the local campaigns, and they're very strongly skewed towards normalising dementia, having people with dementia as a normal part of their communities, affecting local attitudes and acceptance, and a lot of training going on with shop workers and so on, so they can recognise and identify what to do if someone seems distressed or is lost. But the interesting thing for us was that whilst these campaigning organisations are all down here, what they're missing is this issue around increasing understanding and interaction in coping with people with dementia that other groups will experience. And this was a bit of a surprise to us because we expected that these campaigning organisations are often staffed by volunteer carers or people who have a family connection. So we would have thought, we hypothesised that the health agenda and the carer agenda would dominate these organisations, but that doesn't seem to be the case. Rather, these are being not addressed, they're being in some way avoided, and nevertheless identify a significant need for future priorities. So where does this leave us? Well, with voice and campaigning, people with dementia emphasise the need for social engagement, rights and inclusion, enabling public acceptance. And they also mention campaigns related to prevention and stalling the progression of the condition once it's being diagnosed. So one of the sub-themes that came out was that prevention doesn't stop when you've been diagnosed. And in fact, they were saying, look, we want to know how to cope with this, how to arrest its progress, how in some way to improve our condition. Carers and health professionals had considerable overlap. Service professionals and social workers were closest in emphasis, as one might expect, to people living with dementia in communities. But prior prevention is most often mentioned by service professionals. One of the things that you may have noticed in those radar diagrams was that healthcare systems and services weren't prioritised by any group, including healthcare professionals. These were not on the agenda. They were not saying we need more services, or we need to get more understanding that it is a disease, or we need to get more on prevention. This did not come through in any group that we discussed. We interviewed. And maybe what we're seeing here is that this normalising agenda and increased understanding and interaction skills needed by people without dementia are two sides of the same coin. And what it's saying is that there is indeed a shift away from a medicalised perspective towards a community-based perspective of how we think about dementia. And by two sides of the same coin, I mean that people with dementia want to be included. People without dementia want to understand how to interact with them. So we're not so much dealing with a problem of stigma here, that people somehow feel contaminated or discussed at dementia. What we're dealing with is a problem of interpersonal communication. So just to summarise the whole lot, there was a common feeling that dementia should become a normal part of social life. That people with dementia emphasise the need for social engagement, rights and inclusion, by which they meant enabling public acceptance and normal social relations between them and others. Professionals and carers expressed the need for knowledge on how to communicate and interact with people with dementia. Information on prevention in healthcare systems were a low priority amongst all of the respondents. And this contrasts with current campaigns such as the WHO 2016 focus on disease, health service priorities and prevention. There seems to be quite a strong shift going on here away from that model towards a much more socialised view of how we should be responding to dementia. Local and national campaigns, it appears, accept the person with dementia voice, but may be missing others' interactive needs. And people with dementia and carers hold distinctive positions, and we shouldn't lump them together in policy terms as consumers. We're not talking about providers and consumers here. We're talking about people with very different needs and priorities depending upon where they sit in relation to dementia itself. So, in conclusion, and this is really conclusions that we can then fold back into campaigning and public health initiatives. Considering closeness and voice perspective should provoke, I think, a rethink of how campaigns are targeted. We're seeing much more segmentation in the way people are thinking about dementia, pushing out one message and waiting for it to be accepted. So taking the priorities of the recipient of the message more explicitly into account might help compared to the focusing on the reception of predefined messages. Because if you do a literature review on public health campaigning and dementia, what you find is large surveys in many different countries saying, have they got the message? Have the general public got the message? It can be prevented. It is a disease, and so on. What we're seeing is, well, maybe, but if you want people to listen, you're going to have to try and understand where they're coming from. And they're not coming from there. They're coming from something else. So it tends to place that series of predefined messages within quite a limited narrative frame, which is about health and about health services. So rather than reflecting stigmatizing behaviour, professional groups express this sense of inhibition, plus a need for knowledge on how to communicate and interact with people with dementia. So that again needs to be factored in to what people are offering in terms of public health. That this general notion of it being something to do with communication is something which could have much more emphasis and maybe connect the sort of rights and normalising agenda with the health and everyday interaction agenda. And finally, greater emphasis should be placed on people with dementia and their carers, social inclusion and engagement in neighbourhoods and in wider society. Okay, well that's where we're up to. We're still analysing this and we're still trying to work out how to best present it. And we're also needing to present it to a number of user groups that we've worked with and to the government to see how they respond. But that's about it. So, yes.
Yes, thank you very much. I was just wondering about these questions on campaigning. Those were also directed to these 111 respondents, right? Plus this extra. But I think when you do a campaign, your target group may be very different, maybe the general population. And I think these service workers, they are, of course, they have some relationship to people with dementia in their profession. Whereas a lot of people do not really have any connection at all. Aren't they? Can't like the general population also be a target group for a campaign?
Not using a qualitative frame, it's just...
No, but
yeah, I mean...
But I thought you meant by these campaigns, they may have in themselves have different target groups, right?
Yeah.
I guess.
So if they want to influence service professionals, which I think are much closer to members of the general population of working age than many other groups, they'll need to change their message a bit because these people will only, if they haven't got a family connection, they'll only respond on a need-to-know basis. Yeah. And maybe the need-to-know basis is somewhere in that, well, if I meet someone like this, how do I respond? But yeah, you're quite right. This is not a general survey by any means, but it might give pointers to future surveys rather than asking these questions about how is the current public health message being accepted. We're saying, well, how far does it connect to different groups with vaguely different interests? But
But these people, the service people, did they all know and interact with people with dementia, or?
No, I mean, it was about half and half. But when I say service professionals, there were like hospitality staff and people like that. But there were also, we interviewed people who were like IT programmers. So it was that sort of connective space as well. So I'm not that worried at this stage that we're not getting a general public view. I think we're getting a view of people who may come across it. Now, what dementia research shows, and many NGOs claim, is that everybody is touched by dementia in some way. It's becoming much more a common experience and a less hidden experience. And that's why we began to get interested in, well, what does that mean? Let's look at family connection and whether people without and with have a different approach. Because there was this assumption in the campaigning that, that it was everybody's problem because everybody is touched by it, because most people either know of someone or have in their own family someone with dementia. So we wanted to unpack that a bit and see what might that mean in terms of people's attitudes.
Did you do some kind of review of the different campaigns that exist, or you mentioned something with literature review, but did you do some kind of review of existing campaigns and kind of analyzing how they are targeted and what the sort of the main message is?
Well, it was just too hard. What we found was, because there's always a gap between putting in a proposal and doing the work. And what we found was that when we wrote this about 5 years ago, campaigns were fairly small, actually. So you could look at, say, the New Zealand or the Australian campaigning organisation and find that they had one big campaign and one website. What has happened in that period of time is that you're getting multiple campaigns and multiple websites. So the idea of picking up a campaign and content analysing it won't work. So what we did instead was we interviewed people who were responsible for campaigning approaches in these just under a dozen organisations, and asked them what they thought their priorities were. Was there a campaign that they were particularly proud of? What did they think the purpose of campaigning was? Those sorts of questions. What would be their priorities? And what we found was that, in fact, the national campaigns tended to adapt to their local national circumstances. So depending upon the sort of welfare state they were working with, depending upon, well, that was a major factor actually, depending upon how they had to generate funding, they would focus their campaign on certain things. But there was this sort of core series of issues that they thought were priorities. The local ones were much more focused. They were much more engaged in, getting people in communities working together around the issue, but also had much more governance driven by people with dementia. And that may be where we're seeing this big shift from the local out towards an organisation, but not towards health and care as priorities.
Did I understand you correctly that you were cooperating with people from other countries, but the data that you showed here is Australian, right? Or was it from
the local ones that we used were Australian.
Yeah.
They're all Australian.
So the ones you showed here were Australian.
The national campaigns were from those countries I mentioned.
Okay. But the data, the interviews with people, they were from
We
Australia.
interviewed organisers working in those campaigns. So we contacted the campaign and said, this is what we're doing, who would be the best person to speak to?
Because I was reflecting Emma's question about, because I think maybe also what is uncovered here is knowledge gaps in terms of what is it people would like to know more about And I think that's very relevant to know then about the campaigns, what you've already been informed about, in a sense, because you might already have heard about the development of dementia and prevention and so on, but what you need now is, as you said, more interpersonal communication skills. So that these are the issues that people are actually looking for. So it could be interesting to see in a comparison with the other countries, because I'm assuming that national campaigns are somewhat different across the different countries. So it would be interesting, because I see this more as what do we need to know more about, rather than this is a diagnosis of all the elements that we need to know about dementia. If we knew nothing, because we already have some basis that we know about dementia. So this is in addition to this, what we need to know. That was my interpretation of what you presented here today. So it might look very different in Denmark, for instance.
It's showing us, I mean, the national data is actually quite difficult to put together. So you can only look for common areas because they do tend to focus on these, context-specific priorities. It's very different. If you look at Sweden or Finland, it's very different to the United States, for example. And yeah, I mean, this is in addition to what people are already doing, but it does tend to say, well, different groups are emphasising one thing or another, and it does seem to be that this one issue isn't really being addressed. So we're feeding that back now to the various campaigners who we spoke with in the different countries and in the local municipalities. And when I get back, we're going to be doing sort of future search workshops with the local groups and with the policy people to try and say, well, how can we work with this? What does this mean?
I was also thinking there was actually at one point in time one project at SFI. I wonder if any of you were involved in it. This was about information campaigns to service people like bus drivers, hairdressers, and so on about dementia. So this was actually a project on campaigning and what kind of information these groups would need. So there is, I think Rege was part of that. So people here have actually been involved in something similar.
Oh, right. Oh, we should look at that. Yeah.
Well, if there isn't any other comments or questions, then thank you so much.